Welcome to Chapter 5, the Digestive System. In Chapter 5, the course objectives are to identify the functions of the digestive system, to define terms related to the digestive system, to define the word parts related to the digestive system, to define common medical terminology related to the digestive system, and to explain abbreviations used in the digestive system. So first you need to understand the anatomy and physiology of the digestive system. Its functions is to intake food to provide nutrients, to break down food into usable nutrients, to absorb nutrients from food, and then to eliminate solid waste products. When you talk about the organs and structures of the digestive system, it's composed of the digestive tract and its associated glands and organs. And this leads from the mouth through the anus, through the pharynx, esophagus, stomach, and intestines. And it's also known as the GI tract or the alimentary canal. And I'm going to refer to it from here forward as the GI tract. One thing you always want to remember is the GI tract, T-R-A-C-T, not tract, T-R-A-C-K, especially when you are documenting in a medical record. It's very important that you make that differentiation. So it begins in the mouth, through the pharynx, into the stomach, and then some associated organs in the mouth are the salivary glands, parotid, sublingual, and submandibular glands, the pharynx and the esophagus. So the windpipe is usually referred to as the pharynx. Esophagus is going into the stomach. The pharynx goes into the trachea, which is not part of the digestive system. We move to the stomach, and next to that is the liver, but the stomach moves into the duodenum, and then, which is really the upper part of the small intestine. Associated organs are the liver, gallbladder, pancreas. Then we move into the this has, we're going to go into greater detail, but the transverse colon, descending colon, ascending colon, cecum, rectum, appendix, and the anus. So structures of the mouth are the palate that separates the oral and nasal cavity. The uvula hangs in the posterior portion of the oral cavity. The tongue, it assists in swallowing and speaking. The teeth provide hard surfaces for mastication. Regions of the stomach from an anatomy and physiology perspective are the cardia, where the esophagus connects to the stomach. The fundus is the superior dome portion. The body is between the fundus and the pylorus. The pylorus is the lower portion connecting to the small intestine, and the rugae are the folds of the stomach lining. The stomach in the sections for a visualization: the lower esophageal sphincter. The esophagus leads into the stomach. The sphincter prevents the backflow of contents. The cardia is the upper portion. Pyloric sphincter is what prevents or creates a valve almost for stomach contents into that part of the small intestine or the duodenum. We see the body, the rugae, the pylorus, the pyloric canal. Regions of the small intestine, it's in three regions. The upper portion is the duodenum, is the first section. The jejunum is the middle section. And the ileum is the terminal section that connects to the large intestine. A study tip here: the spelling homonyms, the ileum and ilium, ilium and ileum are homonyms. That is, they are spelled differently but sound alike. The ileum is the upper section of the hip bone, ILIUM, and both the hip and the ileum, which is the terminal section of the large intestine. They both contain the letter I, but remember that is part of the small intestine, which contains the letter E. So ileum is ILIUM for a part of the hip bone, and ileum for the small intestine or entero contains the E there. It's a little confusing. Regions of the large intestine are the cecum, the first portion of the large intestine. The colon extends from the cecum to the rectum. The rectum, which is the extension that holds solid waste, and the anus is the exit from the large intestine to the outside of the body. Regions of the colon is the ascending, which is the first part of the colon goes up, transverse colon, second portion of the colon goes across, and descending, the third portion of the colon that goes down. And the sigmoid colon is the fourth and terminal portion of the colon that joins with the rectum. Here's a geographic representation of the small and large intestines. Very important to know the sections of this. So it's really just memorization here, because this is referred to a lot in medical records. Accessory digestive organs. The liver produces and secretes bile into the gallbladder. Bile is the fluid that aids in digestion, particularly fat digestion. The gallbladder stores bile and sends it to the duodenum, and the pancreas secretes juices or enzymes related to the small intestine that aid in digestion or the breakdown of the larger molecules. These are important: the liver, the gallbladder, and the pancreas, and you can see they all surround the upper portion of the duodenum or the small intestine, because that's where most of your nutrients are absorbed. Combining forms: alimento is for nutrition, ano for anus, bilo for bile, ceco for cecum, and cholecyst for gallbladder. Colo for colon, diverticulum for diverticulum, duodeno for duodenum, entero for small intestine, gastro for stomach, hepato for liver. Laparo or abdomino for abdomen, litho for stone or calculus, oro or stomato for mouth, pepso for digestion, procto for anus and rectum, and sigmoido for sigmoid colon. Some prefixes here: endo, in, within; hyper, above; excessive, peri for around and surrounding; post, after, behind; and retro, backward, behind. Some suffixes: algia or dynia for pain, cele for herniation or protrusion, centesis for puncture to aspirate, emesis for vomiting, gen for origin or production, and graphy for a process of recording. Additional suffixes: iasis for condition of, megaly, enlargement; prandial for meal, scopy, process of examining, examination; stomy for surgical opening, and tripsy for crushing. So other terms you need to know as far as the GI tract: a bolus is the moistened food still inside the mouth. Chyme is partially digested food. Deglutition is the act of swallowing. Mastication, chewing. Peristalsis is the movement of materials through the intestines. Here's a picture of peristalsis, muscle contraction moving food or the bolus there through the intestines. Terms related to defecation: feces is solid waste products. Hematochezia is the passage of bloody stools. Melena is black or tarry stools due to occult blood. Occult blood is blood in the feces and amounts too small to be seen with the naked eye. Terms relating to inflammation: cholecystitis, inflammation of the gallbladder; diverticulitis, inflammation of the diverticulum; gastroenteritis is inflammation of the stomach and intestine; pancreatitis, inflammation of the pancreas, and peritonitis is inflammation of the peritoneal cavity. Terms relating to common intestinal conditions are Crohn's disease, chronic enteritis of an unknown cause, diverticulum, an abnormal pouch on the wall of the intestines. Ileus is the obstruction of the intestine. Intussusception is sliding of one section of the intestine into the adjacent section. Here's a barium enema showing a ruptured diverticulum. And here's an intussusceptation of the ileum. You can see what's going on there. Terms relating to intestinal condition is irritable bowel syndrome, IBD. It's a painful disease with alternating symptoms of constipation and diarrhea. Ulcerative colitis is ulcers in the colon and rectum. Volvulus is twisting of the intestine that can cause an obstruction. Here's a picture of ulcerative colitis. It's terrible. Laboratory test, a hemoccult test, is a screening test used to determine the presence of hidden blood in the feces. A stool culture is the microscopic examinations of feces for pathogens. Some procedures involving endoscopy is the use of an endoscope to examine the inside of organs. Colonoscopy is the process of examining the colon. An esophagogastroduodenoscopy, an EGD, is a process of examining the esophagus, stomach, and duodenum. Here's an endoscopic view of the cecum. Additionally, the flexible sigmoidoscopy is the process of examining the colon and descending colon with flexible endoscope. A laparoscopy is the process of examining the abdominal area. A proctoscopy is the rectum and anus, an examination of. Here's a laparoscopy. You can see how that's done. What are some common surgeries and procedures? An anastomosis is an operative union of the intestines. Glossorrhaphy is a suturing of the tongue. Herniorrhaphy is a suturing of a hernia. And palatoplasty is a surgical repair of the roof of the mouth. Gavage is a feeding through a nasogastric intubation. An NG, or nasogastric intubation, is when you insert a tube through the nose into the stomach for a feeding tube or for suction. TPN, or total parenteral nutrition, is feeding maintained entirely by intravenous injection or other non-gastrointestinal route. Additional surgeries and procedures involving excision include an appendectomy, removal of the appendix, a cholecystectomy, a removal of the gallbladder. A gastrectomy is a removal of the stomach. A gastric resection is removal of the section of the stomach, and a polypectomy is a removal of polyps. Here's an endoscopic colon polypectomy. Medications, antacids used to reduce stomach acid, and antidiarrheal used to stop or prevent diarrhea. An antiemetic used to stop or prevent nausea and vomiting. An emetic is used to induce vomiting, and a laxative is used to promote the expulsion of feces. Who are the specialists? Well, the specialty is gastroenterology. It's concerned with the diagnosis and treatment of disorders of the GI tract. Gastroenterologist is a physician who specializes in gastroenterology. Proctology, concerned with the diagnosis and treatment of disorders of the anus and rectum, and a proctologist is a physician who specializes in proctology. Abbreviations common: AMP resection, abdominoperineal resection, BE barium enema, BM bowel movement, EGD is esophagogastroduodenoscopy, and GERD is gastroesophageal reflux disease. GI, gastrointestinal, IBS, irritable bowel, and G, nasogastric, PUD, peptic ulcer, TPN, total parenteral nutrition, UGI, upper gastrointestinal, and that's the end.